While your knee hurts a lot more after menopause, there are many problems in today's modern world. I don't know, did you realize that number one causes of disability for women after 50 is going to be knee arthritis and similar kind of conditions. And in today's video, I'm going to explain why this is especially a problem after 50 years and older. If your knees start hurting after 50 and you didn't fall, you didn't twist anything, you didn't increase workout, you didn't suddenly gain a large amount of weight, and yet the stiffness is there in the morning. The discomfort appears when climbing stairs, when standing up from the chair, when kneeling down, and you start wondering where this comes from. You're not imagining it. For many people, knee begins or becomes noticeably worse during or after menopause. And it is not about aging, it is not simply wear and tear. There is biological reason behind the shift, and during menopause, estrogen levels decline significantly, and most women associate estrogen with reproduction. And probably you already know, of course, when you go through menopause, your estrogen and progesterone level is going to be significantly low, almost 90%, my dear woman. But there is a couple more problems with your hormonal disbalances. This is especially important with women who have a lot of those cortisol level and insulin level very high. Those are four major problems: estrogen, progesterone, cortisol, and insulin really can make worse your knee problems, and this is especially happening for you women after 50 years and older. Estrogen also plays a protective role in the joints. It helps regulate inflammation, it supports cartilage maintenance, it influences collagen production, and it contributes to joint lubrication. When estrogen decreases, the internal environment of the joint changes, and the cartilage becomes more vulnerable. Inflammatory signaling increases, and repair processes slow down. And over time, the subtle changes can translate it into increased stiffness, decreased joint cushioning, and more noticeable pain during movement. So when your knees start hurting after 50, it is not often random. It is frequently linked to hormonal transition combined with the natural structural adaptation. It's going to be, of course, hormonal changes, but there's many other factors that contribute in that knee osteoarthritis is number one disease and problems with a woman 50 years and older, and they cause a lot of those disabilities. It's going to be unbelievably high amount of those processed food that you'll be eating for the last couple of decades, usually accompanied with low quality of sleeping, and especially if you take a lot of chemical medications for other type of diseases. All of this with hormonal disbalances is one of the main reasons why you have knee osteoarthritis, and usually this coming for the maybe 5-10 years before when you realize those problems. But after menopause it's getting a lot worse. And what changes after menopause? Estrogen is not only a reproductive hormone, it also plays a role in cartilage maintenance, collagen production, joint lubrication, and inflammatory control and the bone metabolism. And cartilage is the smooth tissue covering the end of the bones, and it allows your knee to joint to move without friction. When estrogen declines, cartilage repair capacity gradually decreases, and at the same time inflammatory activity may increase, and this creates a slow structural changes inside your joint, and not overnight but progressively. And one thing that you need to remember for today's video is going to be those estrogen level is connected with a lot of those normally bodily functions with your body, especially after 50, my dear woman. But a lot of you didn't realize that those estrogen directly is connected with your knee problems. That is why we need to think about it, how we can normalize estrogen in our body after 50 in the safe and natural way. After menopause, many women experience mild but persistent increase in low-grade inflammation, and this not necessarily shows as a redness or swelling. It is more subtle. But inside the joint, inflammation accelerates cartilage thinning, joint space narrowing, and stiffness in the morning, discomfort when climbing the stairs, and pain after prolonged sitting. And estrogen previously helped regulate inflammatory signaling. When it declines, the balance shifts, and for women predisposed to osteoarthritis, this accelerates all those problems. And when you start to realize that you have knee osteoarthritis and you never connect your knee osteoarthritis with the problems with your hormonal changes, that is even worse. But I'm going to also help you what you can do to help those knee osteoarthritis in a safe and natural way, and protect yourself from knee osteoarthritis in the safe and natural way, of course. What can you do? First, you're going to preserve the muscle. Even light resistant training improves joint stability. Strong quadriceps protects the knee joint, and hip strengthening reduces medial knee stress. Second, reduce inflammatory triggers. Reduce ultra-processed food, limit refined carbohydrates, and increase omega-3 sources, and maintain stable blood sugar. Third, maintain healthy body composition. Even modest weight training reduce mechanical load of the knee significantly. Even kilogram loss to lower your joint stress during movement. And the fourth, protect connective tissues, ensure adequate protein intake, support collagen production, and maintain vitamin D and magnesium level. And this is also important. A lot of you don't realize it. Almost 90-95% women after 50 years and older don't do any kind of exercise, especially weight exercise. This is so crucially important. Exercise regularly with the weight is going to help you a lot. Of course, eat healthy, sleep, good quality, of course, sleep, and take those natural remedies each day. I'm going to give you my special recommendation that will help a lot of my patients for women after 50 years and older. Perfect natural remedies for your knee osteoarthritis. My recommendation for today is going to be Boswellia serrata. Is a resin extracted from Boswellia tree. It has been used traditionally for centuries in inflammatory conditions, and the active compound known as boswellic acid may help modulate inflammatory pathways inside the joints. And research suggested Boswellia may support joint discomfort, improve mobility, reduce inflammatory mediators, and assist in maintaining cartilage integrity. Unlike common pain relievers, its action is regulatory, not simple masking discomfort. If I did anything learned for the last 26 years working with knee osteoarthritis, is going to be a healthy way of living, and natural remedies is number one reason why you will be healthy. Not injections, not chemical medication, not operation. And there's a lot of those natural remedies that really can help you. But for today's video, please try remember Boswellia serrata. Help a lot of my patients with knee osteoarthritis. I believe it can help you a lot. How Boswellia is commonly used? You can use in capsules form, and standardized extract is typically 300 to 500 milligrams 1 to 3 times daily depending on formulation. You can drink tea. It is less common, as a resin is usually standardized in extract form, or you can use tincture, available in liquid extracts used according to the label instruction. It is generally well tolerated, but individuals on anti-inflammatory medications should consult a physician before use. And after menopause, joint discomfort is often combined of hormonal changes, inflammatory shift, and structural adaptation. And muscle strength improves and inflammatory begins to regulate, many women notice meaningful improvement in function and mobility. And this is, my dear viewers, how you can be healthy, especially be healthy after 50 years and older. A lot of those problems are going to happen. And the only way how you can be healthy and you maintain normal body hormonal changes is going to be healthy way with natural remedies. For today's video, this is all, my dear viewers. If you want to find out a lot more solutions about nutrition and natural remedies for your knee, for your hormonal changes, search for my channel, especially if you are first time here. On my channel right now is almost 6,000 videos that really can help you. My private medical office works with the patient all around the world for the last 26 years. You can seek my private phone consultations, or you can come directly to my MarioLab center in Zagreb, Croatia. All you need to do is just call my office on the phone number +385 989179 Call my office, seek my private consultations, or you can come directly to my office. I'll be making sure that you'll be healthy again in the safe and the natural way.